this City of Houston special, empowering youth to combat COVID-19. My name is Juliette Stepech, Mayor Sylvester Turner's Director of Education for the City of Houston.
And I'm Brandon Denton, Associate Director of Education for Mayor Sylvester Turner's Office of Education. Just a few weeks ago, we learned of a novel coronavirus that possibly transmitted from person to person. While there is no vaccine or cure, we learned from healthcare experts that effective strategies exist to prevent the spread of coronavirus COVID-19, including regular hand washing, physical distancing, and wearing a cloth face mask. We want to personally thank all of you for remaining vigilant and respecting and carefully following recommended health advice concerning COVID-19. Every Houstonian, including your youth, our youth, needs to learn skills, habits, and routines to combat COVID-19 and what to do if they have signs and symptoms of COVID-19. We are all a part of the solution.
On April 23, 2020, Mayor Sylvester Turner launched the Health Equity Response Task Force to accelerate and expand critical information to educate and empower all communities, but especially the elderly, Black, Latinx, and other at-risk and vulnerable populations with the knowledge and skills needed to remain safe. Mayor Turner has dedicated several leaders to this initiative from the City of Houston, including Shannon Buggs, Director of Complete Communities, Marissa Aho, Chief Resiliency Officer, Janice Weaver, Director of Community Relations, Susan Christian, Director of Mayor's Office of Special Events, Jesse Bounds, Mayor's Chief Innovation Officer, and myself. Today we have two very special guests who are also members of the Medical and Public Health Education Subcommittees of the HER Task Force. They're here today to share their valuable time and information to give us an update and share how we can empower our youth to combat COVID-19. Before that, we're going to take a short break. Stay tuned.
Worried your friend's struggling but don't know how to reach out?
You could say, how are you, or get a fake tattoo. You could ask with an app if it works for you. You could write them a text or knit them a sweater. If you can't be together, you could write them a letter. Whatever gets you talking. Whatever gets you talking. You could chat on the game, kick off your flip-flops. You could ask on your couch while you binge watch. However you do it, you gotta ask a friend. And if they don't share, you can ask again. Whatever gets you talking. Whatever gets you talking.
There are a lot of ways to reach out to a friend about their mental health. Learn how you can help at seizetheawkward.org.
Welcome back. Today, we are pleased to be joined by Dr. Asim Shah, who is the Executive Vice Chair and Professor in the Menninger Department of Psychiatry and Behavioral Sciences at the Department of Community and Family Medicine, Baylor College of Medicine. He is also Chief of Psychiatry for Ben Taub Hospital, Harris Health System, and the Director of Community Behavioral Health Program for Harris Health System. He is also on the HER Task Force Medical Subcommittee and serves as the co-chair of the Public Health Education Subcommittee. Dr. Shah, thank you for serving the community and for joining us here today.
My pleasure. Thank you.
Are you doing okay?
I'm doing well.
You look healthy and well. That's good to know.
Yeah, I'm doing well. I'm glad we are 6 feet apart, so
That's
I
right.
don't have to wear the mask necessarily, but I have it in my hand if needed. So.
Absolutely. So everybody knows we're practicing safe
Sure.
social distancing. So tell us a little bit about how you think about how COVID has impacted Houston in general.
Yeah. When COVID started, I think the city, the county were able to take adequate measure at the right time, and the rodeo was a prime example for us, that if rodeo would have continued, we would have seen perhaps a very different picture, but I'm glad the mayor was able to immediately come in and stop that, so that helped. Our trajectory, what we have seen, of course, the worst people have seen is New York and Italy. Our trajectory so far is looking close to Seattle, and we are moving in the right direction because of the measures city has taken and people are taking and the education people have been giving. So yes, we are looking a little better. Of course, still even single death is a death, but we are looking better than what it could have been. So that's important.
Okay. good deal. So you're co-chair of the Public Health Education Subcommittee. Tell us a little bit about the HERT Task Force and what that committee is responsible for.
As the name says, HERT Task Force, it's Health Equity Response Task Force. So what we have seen now, initially we saw this disease affect different population, but now what we are seeing is the disease is affecting more seriously people of color, people who are underserved, people who are minority groups, and we want to divert our attention to prevent this disease from spreading in that group. That's one of the purposes of the HERT Task Force. So our focus is the areas which we have identified, the 22 neighborhoods, and we are trying to work around those areas to see what we can do to prevent this the spread. So for example, education. Like you know, education is the most important thing, and while we talk about education, people talk about masks, simple things like sometimes people may not wear the mask right, or they may wear the mask below their nose, which is not the right thing, or sometimes people will use a cloth mask and not even wash it for a whole week. That's not good either. So you see a lot of those simple things which look simple, but they're not that simple, and that is our purpose to do that. So another thing we want to do is we want to develop some sort of a curriculum in which we have as much information possible, even on the websites for people to understand, people to get information, like for example, how to deal with anxiety or things of that nature. Those are all very important right now.
Yeah, so I think that I took some good advice from you as well. I'm going to wash my cloth mask because I
Yes.
hadn't washed it since I got it.
No. This is the problem. So the two biggest mistakes people do is, one, they wear a cloth mask and don't wash it. Okay. Second, they wear a glove and think that, oh, they're protected from anything. Sure. Gloves to me are the worst than hands, because hands at least you will wash. But if you have a glove, you have an artificial sense of protection, and you don't wash your hand with a glove. So, but you can still touch your nose, mouth, and face and be infected. So those are the exactly.
So a lot of people are having some anxiety and stress around coronavirus, similar to other, tragedies or pandemics that we have experienced. Yeah. Is mental health part of the action plan for the subcommittee, and why is it so important? What's your opinion?
Yeah, mental health is definitely part of the plan for the subcommittee. And the reason it is that we see every disaster causing initially the most mental distress. We saw that during Harvey. We saw that after 9/11. We saw that after Katrina. And those were one-day disasters. Now, this is not a one-day disaster. This is an ongoing disaster. We don't even know when it's going to end. So imagine if one-day disaster can cause mental health impact up to 4 years. What will be the impact of this disaster, which is still ongoing? So of course, it's going to be enormous. We don't even know the long-term effects of that. That is the reason we want to focus on mental health in this public health committee also, whether it is education to people, whether it is, we are also thinking about even developing some apps which we can connect people through the tracers and all of that. So a lot of things can be done. And lastly, it is good to spread the information about mental health warning signs and symptoms, because if people know that, people or caregivers may seek some help because they know what to look into.
Education is very empowering. You said there's opportunities for you all to use not maps, but apps to be able to spread the information. Yeah. Is there other sources of information that we can direct people to?
Sure. So we talked about apps, we talked about curriculum, a lot of stuff would be on website. Also, there is the COVID-19 Health Education Fellowship Program through the Mayor's Task Force, and we'll talk more about the program, I guess, later. But basically, the program will recruit young people between the ages of 18 and 30, and the goal would be they will be given a paid externship, basically, and the goal would be for them to connect with the tracer, connect with all these programs, bring some positivity and bring some new information, because kids and the young people have not only more energy, but they have more ideas, so they can do a lot of those things, and we want the communities which are suffering more to be involved, to take part in this program, as opposed to people who are not of the community, because we feel that if there is a member from your community who helps you, that's always very, very important.
So. Absolutely. So we've heard the words contact tracing a lot over the last couple of weeks. Can you explain what that actually is for everyone who might not know?
Yeah. Contact tracing is the word you're seeing is new buzzword in many ways. So basically, if you think about it, a person goes to a grocery store and that person has fever. So next day you find out that that person develops fever and is tested and is COVID positive. So we know that that person went to a public place, in this case a grocery store. So the tracer as soon as the tracer is identified that this person is COVID positive, the tracer is supposed to check where the person went while the person was infected. So in this case, it was the grocery store. They will check that. They may even put it on the website. If they know who was there, they will try to contact them. If not, they will disseminate the information that people can come forward. So that's how contact tracing is. Or another example is if somebody goes to a place of worship and you find out that person was infected and the person, you ask the person, you interview the person, where were you sitting? I was sitting on the 8th row in the extreme left. So that information will be used by the tracer to spread the information that who was sitting on the 7th row or the 6th row or on the 8th row next to the person or so, and those people would be contacted. If anybody has symptoms, they will be advised what to do. If not, they will be advised to watch for symptoms. So that's basically the simple mechanism of contact tracing.
Sounds very interesting. That sounds very tedious, but...
It is very tedious, but that is the reason if you do the right contact tracing, it is very, very effective. And that's the reason we want to even develop an app which can kind of link into that and work with that. So it's important.
Got it. So one of the biggest questions we've been getting from even youth and children is how can they be involved? You know, they can't go outside, they can't be around friends, but surprisingly, they want to help. Is there any, aside from the CHEF program, which is the Community Health Education Fellowship, do you have any other suggestions?
Yeah, so if you think about it, what we are facing right now is touch starvation. What is touch starvation? We are not able to touch each other. Today, we didn't hug each other or shook hands or anything like that. Human beings want the touch. They want to feel the touch. That's important not only for their immune system, but it also releases oxytocin. That is not happening right now. So what do? We need to connect with each other through videos and Skype and WebEx. What young people can do is they are very much into these apps and into these electronics and into these IT stuff. They can help us connect, bring novel ideas, how to connect with people, your elderly family members, your neighbors and all of that. I think we need to bring, also the second thing they can do is they can perhaps involve and give the message of how to wear the mask, when to wash your hands, all those educational stuff. So they can do a lot to help. They have more energy, more new ideas than you and me, and they can help really a lot.
Definitely. Well, thank you for joining us today and contributing to the conversation.
My pleasure.
Appreciate it very
Thank
much.
you.
So thank you for joining us today. More on this subject when we return in a little bit.
I'm Slim Thug. I recovered from COVID-19. Protect yourself and protect your loved ones and mask up.
As we reopen our city, it's important that we do it safely. Continue to wear your mask in public.
Wear it like a boss.
Mask up, Houston.
With coronavirus spreading, people at higher risk must take extra precautions. You are at higher risk if you're over 65 or if you have an underlying medical condition like heart disease, chronic lung disease, diabetes, or if your immune system is compromised for any reason. If you're at higher risk, stay 6 feet or 2 arm lengths away from others. Better yet, stay home if you can. The choices you make are critical. Please visit coronavirus.gov for more information.
Wash hands now. Wash hands now. Wash hands now. Wash hands now.
Hand washing is one of the best ways to stay healthy all year long.
Welcome back. We're very pleased to be joined by Dr. Kayla Lopez, a physician with principal interests in pediatric cardiovascular imaging and healthcare disparities. Her research interests focus on identifying healthcare disparities among minority and underserved children. Dr. Lopez seeks to incorporate cardiology, public health, and minority health policy to develop research initiatives that directly inform health policy and improve the health care of minorities and underserved populations. She serves on the mayor's HER task force, medical subcommittee, and the public health education subcommittee. Dr. Lopez, thank you so much for joining us here today.
Thank you so much for having me.
Yeah,
I appreciate being here.
I hear that you are a public health physician who also serves as a pediatric cardiologist.
I always say that I'm a public health person first, who then happens to be a pediatric cardiologist. My passion truly is public health, and in that spirit, I would just like to show, I have my mask here, you have your mask on, we're socially distanced, 6 feet apart, but I'm just going to show how easy it is to put on a mask correctly. Notice that I'm not touching the front part of the mask, I'm just touching the sides, and when you take it off, you do the same thing. And so this should be a fairly easy way to actually, when you're in the presence of individuals, put on a mask, and then you're done, you don't have to touch it anymore and take it off the same way.
So these are things that are so important for us to know. Habits and changes of behavior that keep us safe and keep others safe as well, correct?
Correct.
So we know that you're on the Mayor's Health Equity Response Task Force. Can you tell us a little bit about your role and what you've been doing as a part of the subcommittees?
So it's been a pleasure to be a part of these subcommittees because it is such an important effort that the mayor has undertaken in doing this, her task force, because we do know that minority populations and communities are disproportionately affected by the COVID-19. And so some of the things that I've been doing is I tend to lend a voice to communities for which English is a second language. I'm Latina and I speak Spanish, and so a lot of the communities that I interact with are non-English speaking, and so a lot of the importance of understanding that messaging needs to be different for different communities, and we have the most diverse population in the country here in Houston, and so to be able to understand what those nuances are and how messaging needs to be a little bit different for various communities is part of the role that I serve. The other part is then having a large voice in terms of preventative medicine. I am a pediatrician, and so I do have a strong feelings regarding vaccinations, ongoing vaccinations amidst COVID-19. And it's really important to remember some of those other aspects in addition to doing things to help combat COVID-19.
Just in relation to that, Doctor, what is the issue that you've been seeing with the reduction in people having their children going and get vaccinated? And what do you want to tell parents about the importance of vaccinations?
So the American Academy of Pediatrics, which is the primary group that oversees all pediatricians in the country, has had plenty of research studies that have shown that vaccination rates have gone down amidst the pandemic. Some of that had to do with us having to close our offices for a period of time as mandated per certain, I guess, citywide mandates, statewide mandates, et cetera. And some of that had to do with individuals' fear with going out and going to the doctor or going anywhere where there's a risk of contracting COVID-19. And so the importance of continuing your preventative medicine care cannot be understated, because the last thing you need on top of a pandemic is to then have another pandemic of a preventable disease, a disease that can be prevented with vaccinations. In the case of children, for example, and that's also then true for pregnant women. And there are older adults as well that require vaccinations to maintain their health. And so in all facets, it's critically important to remain conscious of the things that you need to do in addition to social distancing, washing your hands, wearing a mask, to maintain your health. That also goes into individuals who have chronic diseases, diabetes, asthma, maintaining that kind of care. And maintaining the type of preventative care so you don't end up in a crisis situation and end up going to the ER. That is also critically important to be able to be safest during this COVID pandemic.
And for the members of our audience that are not familiar, what is the definition of preventative medicine? What does that include?
So preventative medicine is almost exactly what it sounds like. You want to prevent things by occurring by using medicines and by using a type of medicine that avoids that. Not necessarily taking a medicine, but by practicing medicine that can avoid preventable diseases. And so preventative medicine includes things like individuals checking their cholesterol before it becomes an issue or early on. Preventative medicine tries to help people with their weight. Preventative medicine tries to help with vaccinations. And so all doctors actually, on some level, practice preventative medicine. It's actually a field of medicine as well.
Wow.
And so there are individuals who specialize in this as well, which is fantastic. And it's important because not all individuals have the opportunity to be as healthy as they potentially could be, given where they live, given their access to health care, et cetera.
So that leads to another question that I have is, why have minority and underserved communities been so adversely impacted by COVID-19?
Well, first and foremost, it's been well proven that minority communities and underserved communities tend to be essential and frontline workers. And so these are individuals who could not either work remotely. As a matter of fact, there's some statistics that show that for Latinx populations, only 16% of them have types of work that they can work remotely. And so it's just not an option for many individuals. And so they're out there in the front lines, and so they are more exposed. They have a higher exposure risk for COVID-19. Furthermore, there are issues with social distancing, depending on where you live. If you are more impoverished or if you're more poor, you don't have the opportunity to socially distance in different rooms because there's 6 people living in a 2-bedroom home, and so you just don't have those opportunities. And then many of those populations also suffer from what we call comorbid conditions, or conditions that can make them more likely to be sick: diabetes, hypertension, obesity. And some of the reasons for that include systemic-wide issues that have been present for a very long time. Health disparities is not a new thing. Yeah. It's just being demonstrated more obviously during a pandemic like this one, who is highest at risk. And so there's a variety of different reasons why, now more than ever, understanding who has COVID, being able to track and trace those individuals, and then continuing preventative care, all of that is important. And then finally, being able to access medical care. Those are very, very important currently.
So we know that you've described several strategies that can be used to help communities. Is that a part of what the HER task force is working on?
Yes. As a matter of fact, some of the strategies that we are looking at include specific messaging to communities that perhaps don't have the luxury of doing what other communities are doing. So you don't have the luxury of having a 5-bedroom home and everyone stays in their own room. Yeah. Not everybody has that luxury. And so finding ways, washing hands, wearing masks, understanding how to take a mask on and off, understanding about wearing gloves and why it's not fully preventative. All of that matters in terms of our messaging, including getting out into the community and letting people know what is true about COVID, what is not true, what are risks that are higher versus lower, and what we can do to help those communities in those processes.
So as a public health specialist, an expert, what would you say in terms of ways that the City of Houston can improve its outreach to our most vulnerable communities?
So certainly, as we stated before, it is the most diverse city in the country, and so making sure that all of the messaging is available in the various languages is critically important to getting to the communities. Going through channels that communities trust, including faith-based leaders or other very prominent leaders in the community for those communities, instead of just coming in as random individuals that nobody knows. Yeah. It's critically important to partner with community advocates and people who have been active in those communities to be able to get messaging out and have people believe it and understand it as opposed to fear it.
And how can we empower our youth to combat COVID-19?
I love youth. I wouldn't have gone into pediatrics if I didn't. And so teenagers, I think, are a particularly incredible force in this regard. Teenagers, if you empower teenagers to help get messaging, if you empower teenagers to understand about social distancing, if you empower them to understand how forceful and how powerful their voice can be in getting messaging out and in protecting those who can't protect themselves, that's one major way that youth can get involved.
Dr. Lopez, thank you so much for being here and sharing your wisdom and information with us today. We thank you for all of your service to the community as well.
Thank you so much for the opportunity.
More when we return. Thank you.
I'm Carlos Correa of your Houston Astros, and I want to encourage everybody to be a team player and mask up.
As we reopen our city, it's important that we do it safely. Continue to wear your mask in public.
Wear it like an all-star.
Mask up, Houston.
Worried your friend's struggling but don't know how to reach out?
You could say how are you or get a fake tattoo. You could ask with an app if it works for you. You could write them a text or knit them a sweater. If you can't be together, you could write them a letter. Whatever gets you talking. Whatever gets you talking. You could chat on the game, kick off your flip-flops. You can ask on your couch while you binge watch. However you do it, you gotta ask a friend. And if they don't share, you can ask again. Whatever gets you talking. Whatever gets you talking.
There are a lot of ways to reach out to a friend about their mental health. Learn how you can help at seizetheawkward.org.
Hi, I'm Simone Biles. Mask up like a champ to protect yourself and everyone else.
As we reopen our city, it's important that we do it safely. Continue to wear your mask in public.
Wear it like a champ.
Mask up, Houston.
You have to stay home.
Not just to protect yourself, but to protect others.
Stay at least 6 feet away from other people. 2 arms length. Just because you're at home
doesn't mean that we can't be alone together.
How do you protect yourself and others from coronavirus?
Avoid touching your eyes, your nose, and your mouth.
Wash your hands often with soap and water for 20+ seconds.
Clean and disinfect surfaces and objects.
Together, we can help slow the spread.
Welcome back to the show. Juliet, I am excited that we are working together to support all Houstonians, especially our most vulnerable. During this pandemic, we are stronger working together with our public health departments, schools, government, offices, local nonprofits, and community organizations. I'm also excited about our work in developing the COVID-19 Health Education Fellows, or CHEF program, that Dr. Shaw and Dr. Lopez discussed today. We need youth from our unique communities to be a part of the solution. They can bring valuable information about their community to the city. They can serve as trusted members from their community, and they know how to best communicate with their neighbors and friends. COVID case investigation and contact tracing is a specialized skill they need to be able to understand patient confidentiality, including how to conduct interviews without violating a person's confidentiality. And we need persons who are culturally sensitive with strong interpersonal skills to build and maintain trust with patients, contacts, and communities. We also need persons who have basic skills with crisis counseling and how to connect persons who may be difficult to reach or reluctant to engage in conversation. They need to know the local community that they serve.
The CHEF program is designed to empower youth to combat the novel coronavirus. We seek to recruit youth between the ages of 18 to 30 to support Houston's communities that are most vulnerable and at risk to COVID-19. We wish to provide our chefs with training and certification and paid externships at the City of Houston. Our chefs will offer specialty support from research and analysis, data analytics, support of the HER task force subcommittees, contact tracing, providing infection prevention and control guidance, supporting the Houston's call centers, health communication supports, and providing COVID-19 education. We're looking to develop the next generation of public health champions to support our communities to remain safe. We'll be recruiting youth from our local neighborhoods to serve their communities during this difficult time. We wish to empower youth so they will be a part of the solution to combat COVID-19. We'll be posting this information about this new program once it's finalized on our Mayor's Office of Education page and via our City of Houston communication channels. In the meantime, please visit www.houstontx.gov/education for more information, resources, and supports available at this time in light of COVID-19 for families, youth, and our community.
Also, please visit www.hirehoustonyouth.org for updates on Mayor's Hire Houston Youth Program and to search for youth employment opportunities. We also ask companies looking to hire youth between the ages of 16 to 24 to please post your job opportunities as well.
And please don't forget to mark your calendar for the upcoming City of Houston Childhood and Youth Committee meeting. It occurs the second Wednesday of every month.
So thank you all for joining us today. We're united against this disease. We will overcome it. Mask up, wash your hands, and keep your distance.
Remember, Houston, you're part of the solution. Thank you so much.